about how we're using our homeless shelters as closed pod partners in Montgomery County. As Sarah said, I'm a planner for both Prince George's County, which Ray talked about, and Montgomery County, Maryland. So today I'm going to talk to you a little bit about Montgomery County, Maryland. It is in the National Capital Region, so it is right next to Washington, D.C. as well, so of course that comes with all of its own challenges. We have a very diverse population of near 1 million people. So of course with that large of a population, we also have a very large homeless population. On any given day, Montgomery County has about over 1,100 people experiencing homelessness. The Department of Health and Human Services in Montgomery County processes about 3,000 or more folks each year through their various programs. We have 19 shelters in the county. The shelters, it's a little different in this county. The shelters are actually all contracted through the Department of Health and Human Services, so it makes it a little bit easier on the planning side. All the shelters are required to have emergency plans. In addition, the Department of Health and Human Services has a health care for the homeless program. It oversees the medical care for all of its clients in the 19 shelters. It also provides nurse case managers to assist with the clients. So about a year ago, the PHP Program, also under DHHS, approached the health care for the homeless program to talk about possibly becoming closed pod partners. It's actually a very good partnership, a very easy transition. Because there was already this underlying concern from the health care for the homeless program and the shelter operators for how the clients would be able to navigate through very large open pods and how they would be able to just navigate through that population. In addition, there was also a very strong foundation already built with DHHS staff, the shelters, and all the homeless clients. So it made it a very easy transition. So I'm going to talk a little bit about some of those foundational elements here. A very large element here, which really helped us with the closed pod partnership, was a daily medication distribution model. This is in all the shelters. This also includes training for non-medical shelter staff on how to dispense medication to the clients. All the shelters have a designated room or some type of a lock cabinet that locks all the medication. Anyone staying in a shelter is required to register their medications and lock them in this cabinet. All the medications are available at all the shelters every 6 hours at 12, 6, 12, and 6. It's a very established program. All the clients know, they know where to get it. They don't have doctors or nurses at these shelters telling them to take it. They just know where to go, they know to take it. In addition, DHHS also did flu clinics at the shelters every year. Very high turnout rate, about 35% of the clients turned out for the flu vaccines every year. H1N1, we actually saw a bump up of 50%. So we know that the folks want to do this. So becoming a closed pod, again, was a very good transition, was a very easy transition, I think, for a lot of our shelters. We started, the shelters had to volunteer to become a closed pod. 14 of the 19 are volunteering to be closed pod partners and starting to develop their closed pod planning guide with the assistance of the PHP staff. And so I'm going to talk a little bit about the actual concept of how the CRI is going to be distributed. Most of the shelters are actually going to have their CRI pods, their closed pods, in their cafeterias, which can range anywhere from 8 people up to 400 people or so. Everyone is actually going to be receiving an armband, blue for cipro, red for doxy. On the armband is going to have their first dose date, the time and the location where they received it. Because clients cannot receive multiple pills at one time, they will have to go back and get another pill every 12 hours. So again, they're going to be using that daily distribution model, so they can take this armband or the wristband, they can go to any of the shelters and get another dose of medication. In addition, we've also worked with our shelters, so the 3 largest shelters will be picking up at our closed pod pickup site at the county for all the other closed pod shelters. And so it just makes it much more streamlined, much more efficient and effective, and they already have the plans for all of that. Some of the next steps, we're actually doing a tabletop next month with these closed pod partners. They're already going through multiple training and exercises, but we're really doing a tabletop. We're going to do a functional later on this year where they'll actually be driving through, picking up and delivering